Michael, and thanks to all of you for attending and your attention. Thank you.
My name is Bill Miller. I'm the CEO of AI Biotech. AI Biotech is an American International Biotechnology Services. We acquired AI Biotechnology in November of last year. Prior to that, we are a division of Boswick Laboratories. We have a large GYN reference laboratory unit. We have over 60 sales reps out in the field. And we have over 30 to 40 pathologists that focus exclusively on anatomic pathology and reference lab services. So, again, this is some of the technologies we acquired when we brought AI Biotech. We do a lot of reference lab work. Our unique service model has to deal with flexibility and outsourcing. So we're able to do a lot of things for a lot of different clients with the very different needs. We're going to focus on the clinical side of the house. We are as I mentioned earlier, the reference lab for Boswick, and we handle all of the molecular testing. We've been doing business in partnering with AutoGenomics for the last 3 years, and I'm going to talk about a couple of the validations that we've done and some of the tests we've worked on together. The first thing, you guys already talked about the implications of the testing. Our main job is turnaround time. We live and die by turnaround time. We understand that the effects it has in the partnership with our clients, with our patients, and it's all based on how quickly we can get results back to our patients and how it's going to affect the entire chain. So that's going to be our main focus throughout. Our patients' vacation have to do with affect standards of living. Faster quality results enables, as I said earlier, a better and rapid response. The physician practice, if you get faster results, you're going to better use the personnel time. You're going to increase the throughput of your patients, and the rapid result, again, will equate to better care. If there's a drawback here is that physicians are shaping their practices based on how fast we can get the results out to them. So if we fail on our promise, they fail on the promise to their patients. So we have to make sure that we deliver. And in order to do that, we have to partner with the right suppliers, manufacturers, and developers so we can meet that standards and meet that turnaround time, because they are going to reshape their practice based on how we do our job. And if we can't do our job, physicians aren't going to be able to do theirs, and patients aren't going to be taken care of. So that's again, you're going to hear me say that a lot, but that's our most important focus. And if there's a single point that we take out, it's just get our patients their results as soon as possible. Some of the clinical testing we perform, we do HPV, we do HHV, which is an assay that we developed in-house through AI Biotech. TrueSwab, which I'll talk about a little bit, and KRAS and BRAF, which is something that we've acquired over the last 8 months. Again, TrueSwab, Dr. Cole talked about the importance of it. We have a single collection device that allows us to do multiple tests on the records on the single sample. The physician can check all the testing that they want done. The importance about this is that we can go back after 4 weeks and perform another add-on testing. A lot of times physicians will order 2 or 3 panels. They won't get the results they're looking for. They'll call us and say, hey, can you add on a VV panel or a urogen panel? We'll add it on without having to bring the patient back in and having to go through the process again. Simply, our turnaround is 48 hours from the moment we get the sample. With the sample in-house, within 24 hours, the patient and the physician will have the results right in their office. So that's one of the great advantages of our TrueSwab. The HPV-HR, we revalidated when we moved it from our Boswick Laboratories to AI Biotech. We added the 66 strand that was actually decided by AutoGenomics. And the main things we're looking for, it was the clinical samples. We want to determine accuracy, precision, sensitivity, and how well it detected genotyping. We also want to determine the reportable ranges for DNA, and this is an important aspect I'll talk about in a little bit. Accuracy, we perform 100 split samples using the HPV-HR, and we compare it to DiGene, which is a technology that we actually don't have DiGene. We had to outsource it to the laboratory to compare and contrast. Our HPV validation, again, precision. We have multiple analysts run multiple samples, and we perform a checkboard matrix, again, to make sure that the precisions were there. Sensitivity, we extract the DNA for HPV 16 and 18 cell lines, And for the reportable range, we just did a series of dilutions to see how low and how little of copies did we needed to be able to report out an HPV strand. On the accuracy side, we found that Digene and the Infinity were 78% correlating with each other. The important thing here is that 17 of the samples were positive in the Infinity. So when we took it farther and we went back and resequenced, we found out that Digene had missed 17 of the samples. They had undercalled. While the Infinity picked them up, Digene failed to do that. So at the end of the day, we did a 100% correlation after we took Digene. We sequenced the ones that were negative. Everything was in concordance. So we were very pleased with those results. Precision, we had a 93 concordant within all the systems. We have the 7% discordant had to do with some of them picked up more than one strand as we checked them. But again, each 4 samples group assays on the same chip gave a 100% concordant result. So again, we were back to the 100% number that we were looking for. Our sensitivity, our detection was seen to 5 copies of input DNA in the reaction for both 16 and 18. And this is actually data that we're putting together almost to a paper, because this is a publishable. Digene won't pick up a copy unless it's 50,000. And we're talking about 5, a handful of copies the instrument picked up, and it spit as a result. We took those samples, we genotyped them, and we got the results we wanted. So they weren't false positives; they were really there. We can pick up copies between 5 copies and then 2 million copies on the DNA. And clinical testing, again, we validated in November of last year. That's when we acquired AI Biotech. We were done in 4 weeks. We handle anywhere between 200 to 300 samples per day on AI Biotech on a daily basis, and we do about 800 to 900 procedures on a true swab. So we're able to validate systems and assays fairly fast just because of the sheer volume that comes in. Again, our clinical testing, we've done over 10,000 since we validated. The 10 to 15% positive rate for HPV has remained constant, meaning that we're not overcalling or undercalling. That's in accordance to national standards. And we do 100% of positives for genotype. So the moment the physician gets a report, he doesn't just get a positive or negative, or they'll get a report with 14 strands telling them which ones are positive and which ones are not. So it's an individual genotype report that they get with every positive. So we automatically take a positive into genotype, reflex it, and send it to the physician as a means to expedite. Again, turnaround time. It's the bloodline of our business. It expedites the patient care, expedites the need for the physician to have to recall and have to genotype something. So we try to make it easier as much as possible. Again, in conclusion, I know it's been a short presentation because I just really wanted to focus on that. In order to deliver rapid results, instrumentation has to be reliable. We've analyzed several assays, several systems, and we've been working with AutoGenomics for the last 3 years because we believe that the results that we get are dependable and they can be transferred to patient care. Collaborating partners must be chosen carefully based on their ability to deliver reproducible results and their ability to support operations. Again, your partners are going to make or break your operation. If we're asking physicians to redefine the way they do business based on the way we do business, we have to be able to produce and do what we say we do. So it's very important that we pick the right partners and we stay with them, not only just because they're instruments, but because their support and because all the things that they add on, they increases the level of service that we can provide. Again, creating partnership with our physicians becomes crucial. As partnership improves, so will patient care. The better relationship our sales team, our laboratorians, our doctors have with our physicians, the better off the patient's going to be.